I feel like I've talked about this on my channel before. Social media in general, as you know, can just be a big highlight reel that makes us feel like our real lives aren't measuring up. Even though today's video is a little bit difficult to talk about and difficult to share because it makes me feel vulnerable, it's still real life and this is what's going on for us right now, and I feel like I wouldn't be being true to myself or to you guys if I wasn't honest about what's going on. So that's what I'm gonna do today. This video is going to jump around a little bit because I did film clips starting September 3rd when I had my first anatomy scan. I'm gonna try to make this cohesive and understandable for maybe anyone else who's going through something similar, or just for my family and friends to understand what's going on a little bit better as well. Even though this is a bit of a struggle right now, it is the reality and I don't want to hide that. I know it seems like I might be someone who shares everything, but the reality is I don't really. I kept this to myself for at least a month before I told family, and that's because I guess I'm just the type of person who needs to internally process things myself before I start getting input and opinions and any kind of worries from other people. So my apologies to family and friends if you're offended that we didn't tell you right away, but that was a personal decision that had to be made.
Good morning, friends. It is anatomy scan day. I'm 20 weeks today and I'm currently in the McDonald's drive-thru because, you know, I'm starving because I had to get up at 5:30 to get a shower and drink the water and do the things. So we're at McDonald's now. Perfect timing because I got some coupons in the mail yesterday. I'm gonna order my food and then I have a little story for you because something happened yesterday that made me pretty upset. So I'm trying to be in good spirits today. Hang on for that. Got the goods. I also got an orange juice to drink because I had a couple people tell me it was good to drink orange juice before an ultrasound because it gets the baby moving. So we'll see if that actually works. I don't want to eat and talk. So I'm very quickly going to explain. As you probably know, you're not allowed to bring a support person or like the baby's father to ultrasounds or to appointments right now. And I heard that some places were allowing it now. So I thought, you know what, I'll call the hospital and I'll just see if they tell me no. That's the worst thing, but I'd rather know if it's a yes. So I called and I said, I have a 20-week anatomy scan for pregnancy tomorrow. I was just wondering if I was allowed to bring my husband yet. And the girl said, yep, you're allowed one support person. And I was like, oh my God, really? And she was like, yeah, one person's allowed. And so I was shocked. I got really excited that Devin could come and experience this with me finally, because I was like, wow, perfect timing. He can come to my anatomy scan. And then I heard from some sources connected to the hospital that I was most likely given inaccurate information, which was disheartening. And the problem was I couldn't call back to find out the truth because there was no one there on the phones after 4 p.m. and there's no one on the phones until 8 today. And my appointment's at 7 and it's 6:36 now. So I really need to get going. So yeah, I was upset and angry yesterday, but now I'm kind of like, well, it is what it is. There's nothing we can really do about it. I just have to make the most of it. And I guess the bottom line is that I get to see the baby today and we're just going to make sure that the baby is okay and that I'm doing okay. And that's the bottom line here. So yeah, I need to get there because I'm supposed to be there in like 10 minutes. Okay, bye.
Overall, the anatomy scan was a really good experience. The tech who did my ultrasound was so sweet and I felt like I was just hanging out with a friend for an hour. She did tell me that everything looked good, but that she saw a bright spot or echogenic focus on the heart. And she kind of explained to me that it was or could be considered a marker for Down syndrome, but as far as markers go, this particular one was at the very bottom of the list, and normally there would be other factors present as well, which were not present. She also told me, don't worry, this is super common. I even have friends message me sometimes to ask me what this is because it shows up on their ultrasounds. Obviously, I did some of my own research and I found out that an echogenic focus or a bright spot can show up kind of anywhere on the baby. It could show up in the heart, in the lungs, in the bowels, in the kidneys, in so many different places. And a lot of people believe that because the technology nowadays is so much more advanced, it's picking up more things than we would have ever seen in the past. And so these things are being picked up, which is good, but it also can make people worry a little bit if it's nothing. So if it's nothing, it's just a calcium deposit and a totally normal variant. But whenever these things come up, since it is a risk factor for different genetic problems that the baby could have, you are typically referred to maternal-fetal medicine to have a more in-depth scan. I found out about this bright spot on the baby's heart after the first ultrasound, and she told me she couldn't get the best pictures of the baby's heart in general just because of the position that it was in. And so I tried everything. She had me stand up and lay back down, move side to side to get the baby to move, but it was just not moving in the right position. So she said, that's okay, this happens. We'll just have you come back for a second scan in a few weeks and they will get the pictures of the heart. So I did know after that first scan on the 3rd about the echogenic focus, but I didn't tell anybody, not even my family, because we didn't know anything. And I felt like I didn't want to tell family members or friends and then have other people kind of making me worry or stressing me out about it, because I know that I already have a tendency to do that and I didn't want to make it any worse. And at the same time, we didn't know anything other than they saw a bright spot on the baby's heart, but don't worry, it can be nothing. So I didn't want to panic about it. I just wanted to kind of process it myself and keep it to myself. So that's what I did. And she had my ultrasound report from the 20-week scan. So she told me all the good things that were reported. The baby was developing normal. The size of the bones and the organs and things like that looked good. She said I had a good amount of amniotic fluid. My cervix was nice and long, so there was no risk of preterm labor, I guess, because your cervix can be shortened, which can, I think, mean the baby could be at risk of coming earlier. So I didn't have that. She also told me that I do have an anterior placenta, which I knew, but that it was high enough up that it wasn't at risk of covering the cervix. So that's good. That's what they want to see. I just got to the hospital and no one knows that I'm here except for Devin and I and my doctor, obviously. But I'm doing the maternal serum testing today, the 2nd trimester one, because when I met with my OB today, she looked at the ultrasound report for the 20-week anatomy scan and everything looked good on her end. She told me all the good things that she could see, and she just said it said that I would have to go back because they couldn't get any clear shots of the heart. And so then I told her that the tech told me that she saw the echogenic focus in the heart and that it wasn't something to be worried about, but that I was still worried because I am a worrier by nature. And so she said, well, we see these things all the time, but if you're a worrier, I think you should do the serum testing just to ease your mind and know the exact numbers and chances that your child could have Down syndrome. So that's what I'm doing because I'm almost 21 weeks. And so when she looked at everything, she said, okay, you can do this serum testing, but it has to be done today or tomorrow. So they called around all the hospitals and they found me an appointment at the regional for 3 o'clock today, which is only a few hours after my appointment. So that's amazing. I'm really lucky and grateful that we have the healthcare system that we do here, for the most part. So I'm going in for that shortly. My appointment's in 10 minutes, so I should probably go in. I'm a little bit nervous again about blood work because it's not my favorite thing. I
told you guys before, I'm a little bit scared of needles. I get kind of faint, but I'm just reminding myself I did so well the first time, and I'm sure this will be no big deal. And it's only 5 milliliters of blood that they take for this, and for the like initial bloodwork screening, it was like 12 tubes. I was there for a long friggin' time. It was a lot of blood. It was everything. So this is going to be quick and easy, and then I can just tell myself that I did everything to, you know, ease my mind and find out, and at the end of the day, it really doesn't matter what we find out, because yeah, we're gonna love this baby regardless. There's no chance that I'm going to terminate my pregnancy at 21 weeks. That's just not something that I would consider doing. So that's where we're at. I'm gonna put my mask on, and I have my paperwork here, and I'm gonna head in. Did it. I'm getting a little bit better at this every time, and I feel like the fear is getting so much better every time I face it. Like, I didn't hyperventilate this time, I didn't faint, I didn't even need my headphones, so that was good. Also, this was only 1 tube of blood compared to the first one that was like 25, it felt like. So, done.
On September 17th, I went back for my second anatomy scan. So this one was to get what they couldn't get the first time, which was the heart. And I did film that experience, and I kind of talked about it after. So I'm gonna put that footage in right here.
7:30, I have my second ultrasound today. 7:30 a.m., my appointment's at 8, and I just got in the car.
Hi friends, I am home. I've been home for a while actually. I am freaking tired today. But anyways, ultrasound went well to the best of my knowledge. I had a different tech this time, and she had a student with her who was in training. So, I mean, apparently the room was not big enough to socially distance for my husband to come, but it was big enough for there to be 3 of us in there regardless. So that was kind of annoying. I mean, I know that students need the opportunity to learn and practice. My sister is a student nurse right now. I get it, but it's just frustrating as a first-time parent to not be able to have your husband there, who is also the parent of this child. So anyways, since the tech was training a student, it felt like a different experience. Normally, like, they talk to me the entire time, and I've had techs who like turn the screen to show me every time the baby does something cute, which is really cool. This one didn't really talk to me at all. Like, the odd time she'd be like, "Are you still doing okay?" But that was it. So that felt different. I mean, I get that you would have to be very serious and like follow all the rules if you are training someone, because you don't want them to do things that they shouldn't be doing, I guess. I don't know. Anyways, she did show me at the end the baby, and it was head down, pretty low this time. So that was neat. I feel a lot of movements now, which is pretty cool. Baby was still moving a lot. What else? Still stretching out its little legs and crossing the ankles. I mean, everything looked good, I think. She said the results will be sent to my doctor. She should have them by like Tuesday. Today's Thursday. Of course, nothing happens over the weekend. So on Tuesday, I will touch base and try to find out if she has the results. And yeah, I will show you some pictures though. I feel like the pictures will still turn out a little bit better the first time, but here's a little foot. There's a leg. You can see like the knee, leg, ankle, foot. Yeah, this looks like the same thing, foot and leg. This is a hand. Not as cool as my thumbs up picture from last time. And there is baby's head. You can see like the forehead, the nose, a little hand there. There's like a front-on face shot. These are kind of creepy. And there's a little side angle. And okay, I told the tech I didn't want to know the gender, but like, I think that this looks like a penis. And now that I think that, I can't unsee it. And I mean, I'm not a professional at this, but I do have my suspicions.
And I already felt like this baby was a boy, and now I feel like it's really a boy. And there's the foot. And that's it. That's the end. This is probably the best picture. So yeah, that was that. She did spend a lot of time doing the pictures of the heart because that's what they couldn't get the first time. I know the tech could see it a little bit because she told me about the Echogenic Focus, but she didn't take any pictures or like include them in the report. So that's that. So I will talk to my doctor on Tuesday and see if she has the results, and then I will follow up and include that part next.
And she let me know that she got the results back from the second anatomy scan and that everything looked fine, but she said there's vessels that go into the heart and out of the heart, and the tech thought that one of the vessels going out looked a little bit narrow. And she said there is blood flow to it. They can see that it's functioning fine, but it just looks a little bit narrow. So I sent a referral to the IWK. So they are going to call you with an appointment to go to Maternal-fetal Medicine and take a closer look at things just to see what's going on. And she told me on the phone that with babies, they like to really check into everything, especially if it's something with the heart, because my local hospital here doesn't do anything when it comes to the heart, if you know what I mean. Like, they wouldn't do any surgeries if they are required or anything like that. And so she said if there was something wrong, that it would be best for us to know about it and have it evaluated at this IWK hospital, in case it meant we would have to deliver the baby in Halifax at the IWK. And after that, I did kind of get worried and I started Googling things. I don't even know the names and the structures of the heart, but I would just try to Google things to figure out what was going on, which I know that I shouldn't do, but you can't really tell a mother that there might be something wrong with her baby and expect her not to freak out. So I sat with this news again, didn't tell anyone, and well, I told my husband obviously and my doctor knew, but I didn't tell my family right away. They told me my appointment would be October 5th and we could go right up to the maternal-fetal medicine floor and get an in-depth ultrasound. After we found out we were going to have the appointment at the IWK, we decided, well, I guess we should kind of let our families know what's going on now, because we're going out of town, they're going to figure it out. We should just let them know. And at that time, I was okay with telling them because I had had some time to process everything. Overall, being at the IWK, I did feel like we were in really good hands, because I know that they are the ones to deal with anything if there were something wrong, which we still don't really know yet, but I'll get to that. Basically, it was an in-depth ultrasound that just kind of checked out the overall whole baby. And also this was nice because it was the first ultrasound Devin could actually come to, so that was special, even though it was a little scary, but I feel like having him there obviously made me feel a bit better. The nurse who did the sonogram was so sweet. She was such a nice lady, made us feel calm, and I just felt confident in their abilities when we were there. They had a good setup there too. They had a big screen in front of me so I could actually see without having to crank my head to the side, so that was nice. She kind of said, "Do you know why you're here?" And I said, "I know there's an echogenic focus in the heart." And my OB told me that the Sydney hospital thought that one of the vessels going out looked a little bit narrow. And she said, "Yep, so we're gonna take a look at the overall baby today, check all the measurements and all that good stuff." So I did write some notes down from this appointment right away. Devin and I sat in the car and wrote everything down. And that was so that we could explain it to our families. So they told us overall the baby looked great, measurements are average. The baby was 1 pound and 9 ounces and in the 34th percentile, super active. When she started the scan, the baby was breech, and then about a half hour later, it was totally flipped and head down again. The bone measurements and all of that was good. Okay, so at this point, I still had no idea the results from my maternal serum, because when my OB called me to tell me I was going to be sent to the IWK, she told me she still didn't have the results. So the IWK told me, we have the results. Your serum came back great, as if you were a 25-year-old, so the risk of Down syndrome is about 1 in 1,000, which is very low. And then they also explained that where there is an echogenic focus, and some places do still consider that a marker for Down syndrome, even though it typically isn't, that changed our chances to 1 in 500, which they said is still very low. So they did say if we wanted to know for sure, certainty, if the baby had Down syndrome, yes or no, we could do this test called the NIPT, which is through a company in the States. So we would have to pay for it out of pocket because our risk level wasn't high enough that insurance would pay for it. So if we were high enough risk, they would have paid for us to have this test, but we were not. And they said there's no way they would consider doing an amniocentesis because it just wouldn't be worth the risk because we weren't high risk for it. So that was the other question, which I knew that I wouldn't do anyway. So this NIPT blood test is basically, would cost us $130 if we wanted to do it. And it's something that you can do at any stage of your pregnancy. It doesn't need to be done within a certain window. When we talked about it with the doctors, they kind of said that it would be better for us to save that money and put it towards something else for the baby. So ultimately, we decided not to do the blood test. A sonographer nurse and a doctor both looked at the heart in detail. The heart is functioning, and at a glance, it looks perfect. So the chambers are the right size, they're in the right places. The blood flow is good, it's going in the right directions, nothing is coming back through. They did still see the echogenic focus or bright spot, which is common, and like I said, normally just a calcium deposit. So the Sydney hospital told the IWK that one of the vessels looked small when they looked very closely. The doctor at the IWK thought that the valve looked sticky almost, he said, and like not fully opening, kind of like a pinched garden hose. So he explained it to us that sometimes because it was almost pinched or something, the blood would go through a little quicker. And he used the word velocity. He said it had a quicker velocity when it was going through there. Sometimes, not all the time. He couldn't really see exactly what was going on or give a diagnosis at that point, so he wanted us to go back in a few weeks. And they made it so we can have all 3 of our appointments on the same day. So basically what's going to happen is we're going to have a 1-hour fetal echo with diagnostic imaging downstairs. And then in the afternoon, we meet with the pediatric cardiologist at the IWK, and he's going to have the results of that echo, which is basically an ultrasound where they look at the baby's heart and check all the functions for a longer span of time. So I think it's like a full hour. They record how everything is functioning and working. And then we go back to Maternal-fetal Medicine, which is where we were for the first appointment. And that's going to be a kind of combined meeting between the cardiologist and Maternal-fetal Medicine. And they are going to collaborate on what they think is going on and if they think we need to deliver the baby at the IWK. So that's going to be determined by whether or not they think the baby is going to need surgery shortly after birth or not, as far as I know. Because let's say we delivered the baby in Sydney and it did need surgery right away, the baby would have to go in a helicopter to the other hospital, and we probably wouldn't be able to go right away because after giving birth, I wouldn't be able to sit in a car for 5 hours and drive, and I think that would be a lot more stressful. Oh, another thing to mention is Devin, my husband, was born with a heart defect, so he was born with a VSD. It's basically a hole in your heart, and his was detected a few days after he was born, and it was very small. He never needed surgery, but he was monitored and followed by a cardiologist throughout his life, and they just kind of paid a close eye on how things were functioning. So they told us that because he had a heart defect, the chances of this baby having one were increased 2 or 3 times, and not necessarily even for the same defect. It could be anything under the umbrella of congenital heart defect. So they said, really, we should have been sent to the IWK to fetal medicine for closer monitoring of the heart to begin with. I also asked them before we left, I said, so should I be worried right now? And they said, no. What did they say? I wrote it. No, not at all. We're just taking precautions and checking everything out. But as of now, there's no real big concern. So we will get a call for another appointment that will take place in 3 to 4 weeks when the baby's bigger and they can see everything a bit better. And I do feel confident and that we're in good hands when we're in that hospital. So that makes me feel better. I know that the local hospital does not have the means to deal with any kind of heart defects. So as much of a pain as it is to have to travel out of town, especially during COVID still happening, I think that it's in the best interest for us and obviously in the best interest for the baby. And I think overall I'm just grateful that whatever's going on, they detected something so that we can find out what's happening and make a plan to go from there. It's October 14th today, and obviously we're still waiting for our next appointment in the next 2 weeks at the IWK, so I don't have a diagnosis or really any answers right now. I just know that I'm not sure what's going to happen. I'm not sure if we're going to have to go out of town to have this baby. In the end, we're just going to do whatever is the best and safest option. And I'm also just trying to stay positive and hope for the best right now because we don't have any set answers, so I'm trying not to spiral, which is hard for someone who is a worrier and deals with anxiety. So that's what's going on. If you're watching this video or you found this video because you're going through something similar, I'm sending all my love to you, and I know what this feels like. It's hard, but I think we just have to stay positive and hope for the best and take each day one at a time and try not to stress and spiral because it's easy to do. So thank you guys for watching this video. After we have our next appointment, I will post an update as to what's going on and just kind of follow up. Now I'm just happy that overall the baby is healthy. I feel, I'm going to say him because my heart tells me it's a boy. I feel him all the time. He's awake all night. And it's really cool to feel the movements and feel him in there. Sometimes it scares me because they're pretty strong for a baby that's like 2 pounds or less. So that's pretty cool. Thanks for watching. Have an awesome day. I'll see you next time.